Hackensack Meridian Children's Health is comprised of 2 nationally ranked children's hospitals by U.S. News & World Report and are number 1 in New Jersey. Hovnanian Children's Hospital in Neptune and Joseph M. Sanzari Children's Hospital in Hackensack, as well as pediatric inpatient and outpatient services at JFK University Medical Center in Edison. With access to expert pediatricians and over 200 pediatric specialists across the state, Hackensack Meridian Children's Health prides itself on offering specialized pediatric medical care and surgical expertise. To learn more about Hackensack Meridian Children's Health, visit hackensackmeridianhealth.org/kids. Welcome back, everyone, to the Monmouth Moms podcast. We are in full swing of fall 2023, which is unbelievable to me. I don't know where this year went. It's just really flown by. I think I say that every year, but it's just, it's really fall now. So we are getting ready for our fall festival, which is Sunday, October 22nd here at Bellworks. Really excited about that. We'll talk a little bit more at the end of the podcast about what to I guess, expect, right? What to look forward to and all the fun things that we have planned. But today we are continuing our family healthcare series with Hackensack Meridian Children's Health. We have a special guest here today, Dr. Mitchel Alpert. He is the Director of Pediatric Cardiology at Hovnanian Children's Hospital at Jersey Shore University Medical Center. He's the founder of Alpert, Zales, and Castro Pediatric Cardiology, located in Brick and Middletown, New Jersey. Dr. Alpert's expertise includes the treatment of congenital heart defects, a topic he has written about. He served with the Sports Science Committee of the United States Tennis Association for close to a decade, where he studied the effects of high-intensity exercise in young athletes and helped to develop safety protocols. Dr. Alpert is board certified in both pediatrics and pediatric cardiology. He's a fellow of the American Academy of Pediatrics and also the American College of Cardiology. Welcome to the podcast. Thanks for joining us.
Thank you.
We are going to be talking a little bit about a few different things, right? Why children should see the cardiologist. Also some kind of noteworthy, news topics. You see sudden cardiac arrest in children more often these days. We were just talking a little bit before we went on air, why we're hearing a bit more about it, but we're going to talk about prevalence, what to look for, screenings, what you should be concerned about as a parent, especially if your children are in sports, right? And then also, I kind of want to note too that you were my doctor.
So I hear, yes.
Yeah. As a child, as a teen, I was in middle school. So, so funny, small world, things come full circle. But you treated me for vasovagal, or is it neurocardiogenic syncope? What is it?
They're both the same.
They're both the same.
Neurocardiogenic syncope, vasovagal syncope, orthostatic hypotension. They're all similar.
And that's part of, we're not going to get too technical, but I know a little bit more about it. But is it part of POTS, is it in that?
POTS is standing for postural orthostatic tachycardia syndrome, is probably, I would call it the extreme form of orthostatic hypotension, neurocardiogenic syncope. Those are the ones that are really difficult to treat. That would be I would call it the extreme form of what you described with vasovagal syncope.
Got it. So what is vasovagal syncope?
Vasovagal syncope is a lot of ways to look at it. Basically, there's a vagus nerve that sits over the heart. And if you stimulate it, it slows the heart rate down and you can get dizzy and pass out. In older people, believe it or not, men get it from putting their tie on too tight for around the neck. You see it in the adolescent girls from combing their hair too much, in the morning, things like that. That produces a vasovagal reaction. Some people get it in the shower in the morning, standing up. They haven't ate anything, they haven't drank anything, they're standing in a hot shower. Their vessels dilate and their blood pressure drops and they fall to the ground.
Right.
Church is a popular place.
Yes.
Because I've been told if someone faints in church, it's always vasovagal, regardless of the age group, till proven otherwise. You don't eat, you don't drink, you rush late to church, it's hot in there, you don't have any place to take your coat off, and you stand up and you're gone.
Yeah.
The key with that one is, as long as you fall to the ground safely and you have your feet higher than your head, you'll draw the blood back to your head and you'll wake up. But That one tends not to have any long-term side effects, I guess, unless you were leaning over Niagara Falls when it happened. But generally speaking, that's not that dangerous.
Yeah. So I wasn't even really going to bring it up until you arrived this morning, and I was telling you how you were my doctor as a kid, and my experience with vasovagal, which I thought was kind of a bit more uncommon. Most people don't know what it is when I tell anyone about it, and I also. I thought that I'd kind of grown out of it, but really, as in middle school, I think the first time I passed out, I was in wood shop, and I don't know. I think I hit my elbow, but then it was just it just kept happening over and over, especially like that year. And it's scary, right? And especially for parents who their child just keeps passing out, and they can't, they don't know why. But I didn't realize how prevalent it is.
Yeah, I would say we see it at least once a day,
Mm-hmm.
Maybe more. It's very common. People stand up, they pass out. I think it has to do with hydration at this point more than anything else. People just don't drink enough fluid.
Yeah.
And then they go out on a hot day, play sports, and they don't pass out while they're playing sports, but afterwards when they stand around, they get dizzy, they fall to the ground. People just don't hydrate properly, and I think that's a big deal. The other one is there are people who faint at the sight of blood, and my advice is when they're drawing blood, don't be sitting up.
That's what I have to tell every time I get my blood drawn. I'm like, I'm sorry, I'm not a baby. I have to lay down.
Yeah.
It's like, it's such a thing. That and like just a few other things. But like you said, I can't standing for too long sometimes. And I'm always making sure I'm drinking enough. But also like I take electrolyte tabs and like anything with like, I love salt anyway, so that's never an issue. But
yeah, that vasovagal syncope or orthostatic hypertension is one of the few situations where we actually encourage people to take salt. I walk around, I can't take any salt, but I tell the kids to take salt, and the parents look at me like I'm crazy.
Yeah, I used to have to take salt tabs when I was a kid, and also I forget the medication, but now I don't do any of that. Now it's just more like I kind of know how to manage it. It's but like you said, I woke up one morning a few years ago. I hadn't passed out in years, and I think it's actually more frightening as an adult because you're like, what is happening? You're just losing consciousness, and you feel yourself going down. So it's something that you just live with. I'm fine, but interesting and funny, small world that that we know each other in some way. Is that actually, does that happen in younger kids too, or mostly like does it start in the teen years?
It mostly starts in the teen years, and in fact, in the younger kids, when it happens, I start looking for other things. But I will tell you, we have 7-year-olds with this story. Mm-hmm. I start to look for other things, but then I conclude it really was vasovagal syncope in a 7-year-old. But generally, it's an adolescent problem.
Right. Okay. A pediatric cardiologist, you're a specialist. I obviously saw you as a child, but I've never brought my kids to a cardiologist. Do you advise that all children should be at least seen by a cardiologist to be screened at some point in their lives?
Yeah, the short answer to that is no. Not everyone needs to be seen by a pediatric cardiologist. The longer answer is there's a process. Mm-hmm. People should always be seen by their pediatricians, get screening physicals at least once a year. There's a point table, 12 to 15 point physical that the pediatricians, the primary care physicians go through. And if you pass that screening, then you don't need to see a pediatric cardiologist. If you fail the screening, then you do need to see a pediatric cardiologist. A lot of it's based on family history. God forbid, if you have a parent who died suddenly during sports, there's a good chance you're going to have to see a pediatric cardiologist. If you've had dizziness, chest pain, passing out, rapid heart rates, if someone hears sounds in there like heart murmurs or extra sounds, you're going to need to see a pediatric cardiologist. But it's a process of screening. I don't think, I won't say no one ever comes off the street and says, I just want my kid checked, because it happens.
Right.
But it's usually part of a longer process of screening that starts in the primary care and works their way up to the pediatric cardiologist.
Okay. We have heard a lot in the news, I think probably the last couple of years more prevalent about sudden cardiac arrest in children specifically. I think, you do hear often that it's sports related. What is cardiac arrest?
Look, most people think of it as a heart attack, like you think of an adult having a coronary event with a clot in the coronary arteries. Actually has nothing to do with that. A cardiac event is the stopping of the heart where it can't adequately perfuse the body. So blood pressure drops, immediate unconsciousness. You're not in a regular rhythm, usually in a regular rhythm like ventricular fibrillation. And you really need to get that rhythm back to normal. You start with CPR, then you hopefully have an AED, a defibrillator around that somebody knows how to use it, although we've kind of reached a point where if you just turn it on, it tells you what to do anyway. But the definition of cardiac arrest is not enough perfusion to the body. The heart, you can think of it at the heart probably is beating in some fashion, but not well enough to generate a blood pressure.
Mm-hmm. Okay. And how prevalent is it with children?
Yeah, the prevalence issue, how often is something that, is debated.
Mm-hmm.
I mean, I've listened to other people talk, and they use numbers like one in 50,000, 1 in 75,000. The Parent Heart Network, who, believe it or not, is a group of mothers who have gotten together, a very strong lobby for screening.
Mm-hmm.
If you look on their website, they don't try to answer that question. They will answer the question, how many kids had a sudden cardiac arrest in a given year. But the problem with saying the prevalence is, it's easy to know the numerator. You can count the people who died. It's not so easy to know how many kids were actually out there. But the numbers you hear quoted are somewhere around 1 in 50,000 to 1 in 75,000. It's the old story. It's an extremely rare occurrence. You're probably more likely to get hit by a bus, but it's extremely rare unless it happens to you.
Okay.
And you definitely get the feeling in the media that it's happening a lot. And the question you get asked, is it really more prevalent than it used to be? And it's a question that's hard to answer because, when I saw you so many years ago, whatever, there was no social media. So if someone died in Kansas, you'd never hear about it.
Right.
Now you hear every single one. And I feel like there's a lot more than there used to be. And maybe there is. But I don't think the evidence is there yet to back that up.
Interesting. So are there always factors leading up to why a child would go into cardiac arrest? And, is it detectable? Is that why we screen?
We do screen. But you can't pick up everything. Just one of the things I talk about regularly is getting back to screening and then how do you stop it? Screening, which we talked about before, we do some of these screenings. The pediatricians are doing their screenings. We do ECG, electrocardiogram screenings. I think there's one coming up in CBA in a couple of weeks.
Mm-hmm.
We do screenings, but we can screen. We'll never pick up everyone. So I try to tell people we screen on the front end, and on the back end, we try to make sure every sporting event, including practices, have AEDs on site and people know how to use them.
Mm-hmm.
It's amazing. If you have a football game, varsity football in high school, they've got an ambulance with a whole crew ready to go.
Right.
But if you've got a soccer practice going on, I don't know if there's anything out there.
Right.
So we're trying to protect better on the back end. So that's how you screen. But who are the risk factors? Family history, genetics. Like I said, if you have a parent who died of a sudden cardiac arrest, there's a bunch of screenings that have to be done. The number one cause of sudden death is hypertrophic cardiomyopathy, a thickening of the left ventricle. And that can be picked up with routine electrocardiograms, heart murmurs, family histories.
Mm-hmm.
There's other things like, anomalous left coronary arteries, which are harder to pick up. There's all these genetic arrhythmias, which can be picked up if we know to look for it genetically, but we're not doing screening of everything genetically. So we try to do our best on the front end with screening, and on the back end, if we miss something with an AED, but you can't pick up everything screening. So you've got to be ready if something happens. That's why we try to get the sporting events to be prepared for the worst. And hopefully that'll help.
Why is it why do we often hear about screenings related to sports? And is this something that should be, not specifically screened for kids in sports?
Sports is an interesting question because it's very clear that activities increase the incidence of sudden death, at least in regards to sports. That much is clear. So we're trying to screen sports. Boys actually have, last time I read the data, have a 9 times more incidence of sudden death than girls.
Mm.
So that doesn't mean we don't screen the girls, but we know the boys have a lot more higher incidence of sudden death. The problem we get into with screening and what to do with this is screening has to be done it's just a difficult thing. We screen on the front end, we screen on the back end, and we're just trying to prevent as much sudden death as we can, which is why, again, we're trying to keep AED. We're trying to prevent the issues from coming up.
But any kids, obviously, if they're active and they're riding their bikes or they don't specifically have to be enrolled in sports.
Yeah, that's the question I was meaning to answer, and I lost my train of thought there a bit. But yeah, what is the definition of sports? Do we screen? I mean, we're screening for athletes, but if you go out for a basketball team, all the kids are getting screened, but if you go out for a basketball team, they may raise it up. Like if you're playing varsity sports and varsity gym, like if you're in a college playing NCAA varsity, they're going to do everything.
Right.
But if you're home playing in your backyard, which can be very intense, we don't screen for that at all.
Right.
That's why, again, like this idea, some people think like all the high school athletes should be screened. Well, which athletes would that be?
Right.
The basketball players, the football players? What about the golfers? Is that considered a docile sport where you don't have to do it?
Right.
What about the kids who are playing basketball and football in their backyards? So you've got to get back to the screening process of screening the kids, going through the pediatrician, going through the primary care. I will add, which is interesting, if you go to other countries like Italy, they screen their athletes as they define it. So if you're playing varsity football, they'll screen you a certain way. But if you're playing football in your backyard, they won't screen that at all. And that's where you really have to be careful about what you're doing. That's why I always keep getting back to, you want to screen starting in the schools and work your way up. Now, it is true that if you're at a certain level, like if you're playing in the NBA, you're getting EKGs, echocardiograms, MRIs, which was made the Bronny James case particularly happy, the son of LeBron James, who arrested during practice. It was almost hard to believe because he was playing varsity basketball for USC,
right? And
he had to have had everything under the sun to be screened for.
Interesting.
And they didn't pick it up anyway.
Yeah.
And it just tells you what saved him. He had $1 million worth of screening. It didn't work, and they saved him with an AED on the back end.
Right.
So that's why I always say we've got to screen on front end, back end. But the question you raised about who gets screened is an interesting question because we tend to gravitate toward the competitive sports and not the sports being done recreationally. Like if you're playing intramurals, it matters, but sometimes we don't seem to follow that.
Is there a certain age group that you advise to begin testing?
Well, we'll test, in any age group depending on, but the adolescents are the particular problem. Like I said, the adolescent males are 9 times more likely to sudden death than the adolescent females. And I think people think that has to do with the rise of testosterone during puberty.
Oh, interesting.
So the adolescents, but we've had sudden death in females also, so you got to be careful. But it has to, I think puberty increases the incidence of sudden death just from the hormonal changes that go on. That doesn't mean I've never seen an incidence of sudden death in a 7-year-old because we have.
Okay. So are any of these cases symptomatic prior? Maybe they had certain symptoms that they had kind of did, like I was just describing, right? I didn't know what was happening, or I didn't, have, I was talking about my issues with AFib now as an adult and how, I had different palpitations and different things that happened, but I just didn't, I'm a mom and I'm busy. I'm like, oh, I'm fine. Are there circumstances where a child maybe has symptoms, what they're discussing to a parent that you would advise to get screened, or does it kind of happen out of nowhere?
That's a really important question. Interesting. That's one I haven't been asked a lot, because the prior history. That's the number one reason probably people come to the office. My child has chest pain. My child got dizzy during sports. My child was exercising and he got dizzy and almost fell to the ground, the so-called prior stories. A lot of these cases have prior stories. Okay. Now, the better question is how many of them saw a cardiologist and were cleared anyway, and how many of them never went. We have a lot of mothers who come simply because their child complains, well, my child fainted, my child was dizzy. We have to separate it. Did he faint during peak sports? Did he fall during sports? Did he in this history, did he fall during sports? Did he land and break his nose? Did he chip a tooth? Did he need stitches? Did he need anything like that? Or was that a kid in the shower who stood up, hadn't ate or drank anything, fell to the ground and then hydrated and was fine? Those are the histories we talk about. The parents don't necessarily separate that history out the way I just did. So they come in a lot. But there are kids definitely There are many children whose first episode is their last, as sad as it is. And then there are children who something happens and they've even been to cardiologists and nobody found anything. It's not a perfect science. We do the best we can. But yeah, I mean, if you have a child who's passing out or is having chest pain, I would always say, is it at exercise or is it at rest? If you have a child who's having chest pain during exercise, that child's going to need to see a cardiologist.
Right.
And sometimes we screen them out. I will tell you, at the screening clinics, and we get this in the office, I had one just yesterday come in, but there are arrhythmia problems, some things called Wolff-Parkinson-White and syndromes where people can have fatal arrhythmias. Mm-hmm. We pick those up during screenings, like when we go to CBA and places like that, and then they end up going to procedures done in, in Philadelphia, New York, or wherever, and they get the procedure, which is curative. Mm-hmm. The Bronny James situation, from what I can tell, he has a diagnosed lesion he was born with, and they're going to do surgery, and he's going to be fine. I'm not aware he ever had symptoms, and he was screened, never had symptoms, was screened, and then had to be saved with an AED. So it happens that way. But yeah, to answer your question, some people have symptoms that I wish, and then they say, oh yeah, he was complaining of chest pain. Most of them never see a cardiologist, but a few do. And so, then there's others who first episode, unfortunately, was your last episode. That's why, again, you've got to be ready for something happening at any time. You never know.
So if you have a child who's asymptomatic and maybe has been screened and perhaps did not have anything physically wrong with your heart, right? Like that, I don't know, I forget what the term is, but when you're like with my AFib, I don't have anything structurally wrong, structurally wrong, right? So is it possible for you to experience a cardiac arrest without having anything structurally wrong with your heart, or is it always a structural issue?
Well, there's structural in a sense what you're born with, and then there's structural what you're acquired.
Okay.
Generally, the things you're born with, we do pick up.
Mm-hmm.
I mean, you can be blue at birth. We'll pick that up. A lot of the obstetricians are doing amazing work picking up everything before birth these days. So when you say structural, I think it's structural congenital, which you're born with.
Right.
Those are usually well known, and they have protocols for how to handle them. But the structural that comes later on, as I mentioned previously, the number one cause of sudden death is hypertrophic cardiomyopathy, easily picked up on an electrocardiogram and an echocardiogram, mm-hmm. if there's a reason to do one. Now, if they have no symptoms, they may have a heart murmur and that'll get them in a sound, but some of them don't have anything. And mm-hmm. again, unfortunately, their first episode could be their last. But generally, that's a structural problem. Now, there are other problems, like the coronary arteries are not in the right location. They get squeezed during exercise. Those are structural problems, too. That one you're technically born with, but it's not something I think about that way. But those are things that are structural. So structural disease can definitely lead to sudden death. But the other problem is you have all these genetic problems, which aren't structural. They're called channelopathies and things like that, where the genetics, the structure of the heart, the way the heart functions at a molecular level is not correct. You'll never pick that up. The genetics has gotten really good for it, but we don't pick it up. Now, if your father has it, we'll look for you.
Right.
But those are the ones that can lead to sudden death. Those are the ones that can lead to sudden death. And what they're doing now, and it's interesting, but it's late, obviously, is when someone dies suddenly, they will take the blood from the person who died and start looking for things.
Oh, interesting.
And they can find it and say, well, I know why this one died. He had that. And then unfortunately, that child has passed, but the other children can all be screened for
within the family,
so you can save the other kids, and that has happened.
Oh, wow. That's interesting. So we talk about screening. What exactly is screening? What is involved in screening?
Well, again, there's multiple levels of screening. The pediatricians, the primary care people, the people doing the nurses and the doctors coming to the schools doing screening, mm-hmm. they have a checklist of what they're asking for. Have you ever been dizzy? You ever had chest pain? You ever passed out? You have a rapid heart rate? You have family history of people who ever collapsed? You have somebody under 59 or under 50 who had a sudden death with not explained? There's that type of screening which gets you to the cardiologist. Mm-hmm. When you get to the cardiologist, now we want to know, or same thing, dizzy, chest pain, passing out, rapid heart rate. By the time you've gotten to the cardiologist, they've already been screened out. So they're going to get a full physical. They're going to get an electrocardiogram. 99 out of 100 are going to get an echocardiogram.
Right.
If they've had problems with exercise, they're going to get a stress test. If there's something in that story that feels genetic, we will do genetic testing, which in the last, when I first came out into practice, when I saw you probably, many, 15, 20, whatever, how many years ago.
We'll say it's brought closer to 15, but it's not.
Yeah, let's say 15 years ago. When I saw you 15 years ago, there was no genetic testing. That's how much things have changed. And now we're doing it all over the place. So it's those type of screenings, the genetic screenings, the echocardiograms, the electrocardiograms, the histories, the physicals. So there's different, when you say screenings, there's different levels of what you refer to as screening.
Okay. If you have a gut feeling about your child and, maybe they're complaining a little bit about, about having heart, chest pain, right? My daughter says all kinds, she has all ailments. She's a little bit of a, I wouldn't say complainer, but she'll come to me, oh, this hurts, that hurts. She's, so it's labeled dramatic. I kind of have like a sense of whether or not like she's really hurt or if like I really need to get something checked out or if like, something serious. So, if you feel as though maybe your child has been screened in school, but is also complaining about certain things, what resources are available to them? Like what would you advise? Just going to the pediatrician, just explaining, making an appointment with a cardiologist. You also mentioned different screenings available in the community. So what should they do?
Yeah, it always starts with the pediatrician, the primary care, who can sort this out. I don't expect a mother or a parent to be saying, well, did that chest pain occur with exercise? Was it at rest? Were you in the shower? Did you fall down and hurt yourself? That's not their job. They know there's something, they know their child passed out. They know the child's complaining of chest pain. Their job is to take it to the pediatrician and tell the story. The pediatrician will then decide, is this enough to go to a pediatric cardiologist? Some parents will go anyway, and that's their right to do. It's their child. But it starts with the pediatrician, who starts with that multi-point screening to decide whether this one should go to the cardiologist. We don't see every child with chest pain. We don't see every child with a heart murmur. We don't even see every child that passes out.
Right.
They're screened out at the pediatrician level.
Okay.
We will see people who just want to come anyway because they're worried about their child, and we try to reassure them. But everything starts at the primary care level.
I'll ask a question twofold. One, if you do detect some type of preliminary, either defect or, possible chance, I guess, right, of developing some type of issue, is there something that it can be treated with, or is that kind of like opening a can of worms here? And also any preventative measures for children?
Well, it all depends what it is.
Yeah.
You can start with, you'd have to go almost diagnose. That's what you say about the can of worms. You'd almost have to go diagnosis by diagnosis.
Right.
Some things are nothing to worry. Some things can be corrected with a procedure. Some things are corrected with surgery. Most things don't need anything. Some things need medication. Some things that are severe, there is a restriction from sports. It all is what, it depends what we're talking about there. What you talked about earlier with vasovagal syncope, we would never restrict that from sports,
right,
or anything like that. But certain things you'd have to go case by case. I will tell you there is more of a tendency than ever to clear almost everybody for sports. We still don't clear everyone, but I'm finding people being cleared for sports with recommendations that we didn't used to clear from sports. I'm finding people where the parents are being told, have your own AED, don't believe anything that anyone else has one and know how to use it. Kids that 10 years ago we never would have cleared for sports are now getting cleared. Like the thing, probably didn't mention it today, but prolonged QT syndrome is something we see a lot of. And 10 years ago, we never would have cleared them for sports. Now we have them on medication. We're bringing AEDs on site to the sports fields, and we're clearing them for sports. But those are the type of things, prolonged QT, Wolff Parkinson White, those are the type of things we do at these. We do a lot of ECG screenings and things like that. And, but we're getting far more aggressive on the kids we clear than what we used to.
Interesting. Let's talk a little bit about overall heart health in children and families. What are your recommendations, and has that changed, since you began practicing?
Well, it's always back to the basics. If we're just talking about general heart health, it's always going to be, health screenings. It's always going to be diet and exercise and try to stay in shape. Obesity, is really just become overwhelming in this country. The amount of kids that come in with high body mass indexes are just through the roof. If you're not going to exercise and you're going to go to McDonald's every day, chances are you're going to have a high cholesterol.
And that's another thing we didn't talk about. We're more specifically, talking about athletes, but also, do you see cardiac arrest in kids with childhood obesity?
It's rare.
Okay.
But we're setting, that gets into another story. We're setting the stage for later on. Because to rephrase your question, I would say, when do cholesterol plaques start to form in the coronary arteries? It can be 7 or 8 years old.
Wow.
Or even earlier. So the question becomes, I've never seen a 15-year-old have a heart attack from obesity and cholesterol and HDLs and LDLs and this. That with one exception. The transplants have terrible problems with it, but that's a whole other issue. And of course, there's familial homozygous hypercholesterolemia, which people talk about and nobody ever sees. Unfortunately, it's very rare. But overall, no, they don't have heart attacks, but they're setting the stage for later on. If you're going to be, you can always improve it by getting better exercise and more sports, active sports. That, by the way, is why when I mentioned before, we're clearing more and more kids for sports. This is something we're left with. All of us in the office deal with this all the time. Mm-hmm. You get a child coming in who's in the 7th or 8th grade. He weighs 300 pounds, and the gym teacher just sees him as a great guy playing the defensive line, clogging the line or something like that, so they want him to play.
Right.
Pediatrician won't clear him. So I see them in the office, we all do, and then we're left with the question, do we clear him or don't we clear him? And if you clear him, he's at least at more theoretical risk than the other kids.
Oh.
But if you don't clear him, he'll go home and play with his computer and put on 20 more pounds.
Totally.
So I do tend to clear him with the warning to stay hydrated if you don't feel well, because I think it's the lesser of two evils. But we do clear those kids.
Interesting.
You asked the question, if you're overweight, do they have childhood obesity lead to heart attacks and things like that? I've not seen it, but I would imagine if you put enough people out there who are obese and you put them in competitive sports, somebody's going to, and it probably has happened. But That's why we're always pushing to get these kids into sports. We don't want them sitting home. We trading in a congenital problem or a fatal rhythm problem for an obesity problem, which is why I think the tendency is to be more aggressive with allowing sports.
Okay. So I advise daily exercise overall for heart health?
Definitely.
Half hour?
They say half an hour to an hour. Watch your diet better,
What are some good diet tips just for moms to know for overall heart health now?
Well, you want to stay away from the meats, the cheeses, the high cholesterol products. You want to stay more with the high protein products. Just a healthy diet. I mean, there's things that make sense, the salads, the fruits, the vegetables. By the way, nobody could live that life forever. It's like I tell people all the time, stay away from caffeine. It'll stimulate caffeine. Caffeine's a diuretic. If you're having vasovagal syncope and you take caffeine, it's a terrible diuretic. Besides, it makes your heart race. Yep. But nobody's going to live life perfectly. We don't. Nobody does. So if somebody says, I'm just saying, don't be having 10 cups of Red Bull every day or something like that. But if I say try to live the most healthy life you can, try to exercise, try to get into varsity sports like soccer and basketball that have high intensity isotonic sports. It's interesting. The isometric sports. I have kids coming in weightlifting. They look great. They're 300 pounds and they look great, except weightlifting's not the greatest thing for sports like running is. There are different types of sports. So I try to get them more into running sports, but any kind of sports is better than no sports.
And you think running's good overall for your health?
Running is definitely considered like isotonic sports.
Got
running, swimming, those are really great sports. There's the isometric sports like weightlifting, benching. They're not quite as good because they put a lot of pressure in the heart.
What about those high caffeine drinks? I can't even think of the name of one, but they're like extreme caffeine and all they market them to kids. Is that becoming a bigger issue?
You mean the Red Bull and the Monster and
not
all that?
Just, but there's even more, I think now, crazy amounts of caffeine. And
I couldn't name them all either.
Right.
The 5-minute energy drink, 5-hour energy drink or whatever. There's really no reason to ever drink those.
Right.
I mean, like I have a sign in my office that says, doctors stay away from high energy drinks. I should separate the high energy drinks. Like I said, the high caffeine, the ones who we used to think no-dose was a lot when we took a pill. These things are like 10 of them.
Yeah.
That's different than the hydration drinks, the Gatorades and the vitamin waters and the thing. There's 100 of those brands out there too. Those are fine. There's limited to no caffeine in those. The problem with those, and I tell people this all the time, if you're going to be a competitive athlete and burn off 3,000 to 5,000 calories a day, Gatorade is fine. If you're going to sit at your computer all day and drink Gatorade, there's a lot of calories in that stuff. So a lot of sugar, a lot of calories. You have to be careful. But for a competitive athlete, the the hydration drinks like Gatorade and the rest of them are fine.
Electrolytes are important.
Electrolytes are important. But I'll tell you something with that, and I think most of us tell this. Water is probably the best thing you can take. I don't think you can run out of, like, people say, oh, I should have Gatorade for the electrolytes. Now, if you're a competitive athlete sweating all the time, I wouldn't say, no, go ahead, take your Gatorade. But most of us say, just take water, you'll be fine.
Interesting.
But the caffeine hyphenated, the caffeine drinks, the Red Bulls, the Monsters, the 5-hour energy drink, and 10 more that you and I could name. Most people think there's no need for them ever in sports, you know. So, and I think that's true. We don't we never And the other problem is they're so besides the fact your heart will pound out of your chest, they're so dehydrating. They strike me more as the college students who are studying all night rather than the athletes.
Right. Makes sense. Okay. All helpful information. This has been really eye-opening, I'm sure, for so many parents, and, you know, really good to kind of dispel what is, you know, fact over fiction, and a lot of a lot of information out there. So I hope that, you know, so many listening can take this and apply it to, you know, to their own circumstances and their children's sports and non-sports environments, right? You mentioned some community screenings. I think you mentioned one coming up at CBI. Does Hackensack host them throughout the year? And also, where can you find more information about it? Yeah,
Hackensack, we do them in concert with Hackensack. We're very associated with Hackensack Meridian, mostly Jersey Shore, Hovnanian Children's Hospital. We do, you know, before COVID, we were doing 3 or 4 a year. We've come up again now. We're doing 2 to 3 a year. We do at least one a year at St. John Vianney, and that has to do with Nicole's Heart Foundation, which a mother has gotten very active with. Her daughter, unfortunately, passed away from one of the many causes we discussed today. And she has a foundation that funds this. And I think her child, if I remember, was at St. John Vianney. So we do at least one a year there. We have one coming up in a couple weeks at CBA. Now, I think you probably have to be a CBA student, but I'm never quite sure how that works.
Okay.
Hackensack Meridian actually organizes all of these things at this point. They work with the Heart Foundation. They also are there on site. And while we do the ECG screenings, remember I talked about the front end with this and the back end with AEDs, they're teaching how to do CPR and AEDs on site. So they're doing the other things. So we always do them in concert. So we try to do 3 or 4 a year. If any high school or middle school wants it done, they should probably contact Jersey Shore. You're going to ask me who, and
that's okay.
I'm not quite sure either.
We can find out. We'll put it all in the text here for to link in the podcast.
It's a big hospital. I'm never quite sure who I'm contacting, but I'm sure there's plenty of people you can contact.
And how would a parent make an appointment with your practice?
Well, if you wanted to make an appointment with our practice, you would either call. You know, it's Alpert, Zales, Castro Pediatric Cardiology. It's easily found. Our office is in Brick and Middletown. And if you feel a need to come see us or the pediatrician refers you, just call our number. It's 732-458-9666. If you can't remember that, just look on the website.
Yeah. I'll put it all in the text here so you can link it, and I'll link the site too. So, well, thank you so much. This has been great. I hope that, you know, a lot of parents took, you know, a little nugget from this and can feel a little bit better about, you know, about putting their kids in sports and getting them screened.
I hope so.
This coming Sunday, October 22nd, is our fall festival, the Mom with Moms Fall Festival at Bellworks here in Homedale, New Jersey. Come out for Touch-a-Truck. We have a whole indoor kid zone. We have over 80 vendors. So it's a week before Halloween, which essentially, like, I think the day after Halloween these days is Christmas, basically. It just starts the holiday season. So you can shop a little bit early. We're going to have really great boutique vendors here, lots of different community businesses that are going to come out. A lot of them will have candy, so kids can come in costume. We have performances happening from Axelrod, Performing Arts Center. We have a magician doing a show. We have Autocades, which is an indoor video game truck outside at the Touch-a-Truck. We have all kinds of cranes and excavators and dump trucks and all kinds of fun stuff. Face painters, character station. I could go on and on. Yoga. My good friend who runs my Peace Place is going to have some very cool mindfulness and mommy and me yoga sessions happening throughout the day. So much to do from 11 to 3. Please join us. We're excited to kick off the holiday season here in Monmouth County. And more details can be found also in the text here. So that is all. Enjoy your fall day, and we'll see you guys soon.